Have you ever wondered if your patient is taking antibiotics for the correct duration? Welcome to the fascinating world of antibiotic stewardship. The duration of antibiotic treatment is crucial to patient health and well-being. Incorrect usage could lead to detrimental effects, including the frightening prospect of antibiotic resistance. Imagine a world where antibiotics no longer work. It's a sobering thought, isn't it? But don't worry, there's a solution to this potential crisis. An audit can help ensure patients are taking antibiotics as prescribed. Let's delve into this important topic. An audit in this context is a systematic review or assessment of something. In the realm of healthcare, an audit is akin to a checkup, but instead of checking on a patient's health, we're examining the processes and systems in place. The purpose of an audit is to identify areas of improvement and to ensure that the best possible care is being provided to patients. Let's think about antibiotics for a moment. They're a vital part of healthcare, but they are often misused or overused, which can lead to resistance. That's where an audit comes in. We conduct an audit on antibiotic duration to identify any issues in the prescription process or patient compliance. This helps us to rectify any problems and ensure that antibiotics are used appropriately and effectively. So an audit isn't something to be feared or dreaded. Instead, it's a powerful tool that can help us improve patient care. Think of an audit as a helpful tool for improving patient outcomes. Conducting an audit on antibiotic duration involves a few key steps. It's like putting together a puzzle. Each piece has a role in creating the bigger picture. Let's dive into the process. The first step is to select patient records. This might seem simple, but it's a critical part of the process. The selection should be random and representative of your patient population. It's not about picking and choosing. It's about getting an accurate snapshot of prescribing practices. Next, we move on to reviewing antibiotic prescriptions. This is where you roll up your sleeves and dig into the details. Look at when the antibiotics were prescribed, what kind, and most importantly, how long they were prescribed for. It's essential to be thorough to make sure nothing slips through the cracks. Now comes the comparison stage. This is where you'll match up the duration of antibiotic use against established guidelines. You might be thinking, where do I find these guidelines? Well, they can typically be found in clinical practice guidelines or local hospital protocols. These guidelines are based on extensive research and can act as your compass in navigating the sea of data. The fourth step is identifying any discrepancies. If the prescribed duration doesn't align with the guidelines, jot it down. This is not about blaming anyone, it's about understanding where the gaps are and how we can fill them. After all the data is gathered comes the analysis. This is where you'll look for patterns or trends. Are certain antibiotics being overused? Are some patients receiving antibiotics for longer than necessary? These insights can help shape future prescribing practices. Lastly, it's time to share your findings. Prepare a report, present it to your team, and discuss next steps. This is a chance to learn, grow, and ultimately improve patient care. Remember, the goal is not to point fingers, but to identify areas for improvement. Every audit is a step towards better healthcare, a step towards making sure our patients get the best treatment possible. When conducting an audit, there are some key points to remember. Firstly, maintaining confidentiality is paramount. All patient data should be handled with the utmost care to respect privacy and comply with data protection laws. This is not just a legal requirement, but a moral one, as the trust between a patient and their healthcare provider is sacred. Secondly, being systematic and thorough is key. An audit is not a cursory glance over records. It is a detailed examination that requires a methodical approach. Ensure that all areas of the patient's antibiotic use are investigated, including dosage, frequency, and duration. Overlooking even a small detail could lead to incorrect conclusions. Thirdly, an audit should not be seen as a task to get through, but rather an opportunity to improve patient care. The findings from an audit should be used to identify areas of improvement and implement changes. Remember, the ultimate goal is to ensure that patients are taking antibiotics for the correct duration, which is critical for their health and for reducing the risk of antibiotic resistance. Finally, it's important to remember that audits should be conducted periodically, not just as a one-off. Regular auditing can help healthcare professionals stay aware of ongoing issues and monitor the effectiveness of implemented changes. An audit is a powerful tool for healthcare professionals. It can help ensure that patients are taking antibiotics for the correct duration, ultimately improving their health and reducing the risk of antibiotic resistance.